In this video, we will study about the complications of blood transfusion. First, there can be non-hemolytic transfusion reaction. Second, there can be hemolytic transfusion reaction. Third, there can be transfusion-associated circulatory overload. Fourth, there can be TRALI. Fifth, there can be infections. And sixth, dyselectrolytemias. Now let us study each of these in details one by one. First, non-hemolytic transfusion reaction. मतलब ब्लड बाहर से दिया गया है लेकिन हेमोलाइसिस नहीं हुआ है आरबीसीज का. But here the patient will present with fever after transfusion. Okay? And this fever is due to the preformed cytokines and the recipient antibodies. The third important point here is that it is most commonly associated with complications. Now, how can you prevent this? You can prevent this by leukoreduced blood products. Second, non-hemolytic transfusion reaction can present with bacterial contamination, and this bacteria is usually a gram-negative bacteria which can cause sepsis. And third problem that occurs in non-hemolytic transfusion reaction are the allergic reactions which will be presented as rash or itching due to the transfusion of blood or any products which contain antibodies from the donor, or from a hypersensitive donor to a less sensitive or hyposensitive recipient. So non-hemolytic transfusion reaction is presented with allergic reactions, bacterial contaminations and fever. Now how will you treat such patients? The treatment of such patients is histamines because the patient is presenting with rash or allergy, and leukoreduced blood products. Now we move on to the second complication that can occur as a result of transfusion, that is TACO. Now this occurs when there is rapid transfusion of the blood products in elderly patients who are already having a cardiac disease. So here in these patients, there will be circulatory overload which will be seen by the points that you can see in the picture given. Next we move on to the TRALI. This occurs due to anti-HLA antibodies in the transfused blood. Suppose the transfused blood is having anti-HLA antibodies and that is given to the patient, which will cause TRALI. This will attack the circulatory leukocytes in the lungs, and this leads to a non-cardiogenic pulmonary edema with 6 hours of transfusion. Within 6 hours of transfusion, there is non-cardiogenic pulmonary edema. The chief complaints of such patients is decreased SpO2, dyspnea, bilateral coarse crepitus, tachycardia, hypotension, bilateral patchy infiltrates that is seen in the chest X-ray. So all the problems that are related with the lungs will be seen in such patients. How to treat these patients? You discontinue the blood transfusion. Only that can help in this condition. Also, you can give high flow moist oxygen because the patient is having respiratory difficulties. Lastly, if nothing works, you can put the patient on mechanical ventilation. This is the treatment for pulmonary edema that occurs in case of transfusion. Let us move on to the fourth complication, that is hemolytic reactions. This hemolytic reactions can be acute and it can be delayed. But why is hemolysis occurring? Because of the transfusion of ABO incompatible blood. Suppose you are an AB positive person and you've given me blood that is B positive person. So that is mismatching of the blood and that can cause hemolysis. In acute hemolytic reactions, preformed IgM antibodies is given to the ABO antigen. And in delayed case of hemolytic reaction, IgG mediated response will be towards the ABO antigen. And delayed response is 2 to 10 days after transfusion. And acute hemolytic reactions will develop suddenly and will present with chest tightness, flushing, tachycardia, fever, decreased blood pressure, hemoglobinuria, acute kidney injuries. And this can also occur in midway between transfusion, the acute hemolytic reactions. So how will you treat such patients? You have to immediately stop the transfusion reaction and you have to resuscitate the patient and maintain the input-output charting. Now, in case of delayed hemolytic reactions, the patient will present with jaundice, hemoglobinuria. These symptoms should be remembered because they are different in case of acute and delayed. But in delayed, the treatment of choice is steroids. And obviously, you have to stop the transfusion reaction. Now, the next complication of transfusion is the transmission of diseases that is HIV. So, if the blood of the patient who is having HIV, HBV, HCV, CMV, malaria, syphilis, prion disease or brucellosis has been given to a healthy patient, then such infections can occur. And the last complication of transfusion, blood transfusion, is dyselectrolytemia. This can be presented with hypo or hyperkalemia and hypocalcemia. Apart from calcium and potassium abnormalities, acidosis can also be presented in the patients of blood transfusion as a complication. One thing that we should remember in mind that in case of massive blood transfusion, usually the patients present with hypothermia. And in case of chronic blood transfusion, those who are taking blood for a long period of time, iron overload can occur in the body. This iron overload can cause hemosideronemia. This is all about the complications of blood transfusion, which you have to study in mainly 5 headings: hemolytic, non-hemolytic, dyselectronemia, infections,